to reflect, we're all here. We do have a quorum. And with that, we'll ask for approval of the minutes from the February 7th meeting. Trust you've had a chance to read those. If there are no corrections or edits, I ask for approval to, motion to approve.
So moved.
Second.
All right, further discussion, all in favor say aye.
Aye.
Those opposed? All right, thank you. Reports, oral and written communication. We'll start with the monthly response reports, and we'll start with Lutheran first. So,
Good afternoon, everybody.
hello.
January, as we reflect back, actually was one of our busier months than we've had recently. It actually reflected back to the peak of COVID and the run volume that we were seeing and the level of acuity. In January was pretty high. So you'll see that number is reflected there in the report. Lots of very sick patients, the acuity of patients, the level of care that was provided, again, of that higher level. So you'll see our response, again, continues to be that east and west station being where our peak of our calls are. Unfortunately, because of the acuity, you will see it in the time that we were on scene being more extended because they required more treatment. Obviously involves more time on the scene. So you will see that reflected in your numbers in this month's report as well. I do want to just publicly show my appreciation to the staff during the month of January. During the month of January, we had 2 staff members who went off on maternity leave, and we had a staff member who was diagnosed with, unfortunately, terminal cancer that all went off at the same time. And so our staff stepped up and picked up those extra shifts in a time where, you know, everybody's really tired and everybody's exhausted post-COVID in the healthcare world. They weren't afraid to step up and make sure things were covered. And so I did want to just publicly thank them again for what they did for that and really prove to the community how much they're here to serve. So,
Thank you.
Yeah.
Sorry to hear that.
yeah.
Yeah.
Okay.
All right, any questions?
Alicia, out of curiosity,
Yeah.
do you keep track of how many times, like for Leesburg, for example, they had 34 calls, how many of those
Yeah.
were actually into Warsaw's territory?
So how many of those
How many of
34?
34 were actually,
All of those runs were in Warsaw's
Okay.
territory. Yeah,
So that's
that
not
the
Leesburg,
Leesburg truck. Now, that does not mean 34 times does the Leesburg truck respond from Leesburg. They were moving this way, if not already that way, which is why you don't see any effect in the response times because of them responding.
Okay.
But that truck physically took 34 of those calls. Now, a lot of those breakdown we do see being on the weekend when you don't have that additional truck in Warsaw. So I do see that reflection, especially in the Milford numbers being primarily when it's on the weekend.
so those aren't, that's not Leesburg territory calls, those
No,
are Leesburg
no.
coming to Warsaw.
No, those numbers are definitely much higher and different than this
okay.
report. Yep.
Thank you.
Yep, of course.
All right,
Any other questions?
thank you.
Okay, thanks.
Michael, do you want to give the monthly response report?
I can. First off, I'll apologize that there's not the fancy, nice little sheet at the beginning. Due to some computer issues, we were unable to access it till later this afternoon. So I'll try to run down through this first sheet here. Roughly, we had 4 fire-related calls, I think, if memory serves me correctly, 1 structure fire in there, 157 emergency medical calls, 14 vehicle accidents. You scroll down about halfway to where it's 510 on the left-hand column, that's 25. That's going to be your CARES calls for the month. And then the total calls were 269 for the month. And if you want me to go as far in depth, I can break it out per station. Station 1 of those calls had 102 for the month. Let me start over. Station 1 had 102. Station 2 had 99. Station 3 ended up with 39 calls for the month. And then the admin which includes CARES, had 29 calls. There was for training, 689 hours of training within all of the different applications that we trained through. I think Karen or the car seat install crew did, it looks like we did 4 or 3 of them. 1, 2, 3, yeah, there's 4. And 1 check. And then on this last section, which here again, got caught up to speed as to what reports we were giving because I have not attended one of these for a moment or two. On that last sheet, it includes the overlapping calls that we're starting to have to just show the amount of times that we end up having 2 runs within the same district. I mean, I'm not going to go through that. You can look at that, and that's pretty self-explanatory.
Questions? All right, hearing none. Let's move on to the expenditure reports. We'll start with the operating fund. Have you looked down through there? I didn't see anything noteworthy. Some parts and some payroll and benefits. Everything else seemed to be, wait, here's a first due suite. Oh, that's a,
Yeah. So that's going to be, Shirley, correct me if I'm wrong here. That's going to be our annual subscription for first due, which includes our driving. It's on an iPad in the trucks, which gives us driving directions to the call. Then it also does our pre-plan program, and then it is tied to also one of our scheduling programs to schedule for who's on vacation for the year.
so that was $10,518.63. And you assume that that was probably an annual
Yeah.
subscription. Okay. Other questions? If there are none, is there a motion to approve the expenditures as presented?
So moved.
Brandon, thank you. Is there a second?
I second.
Jeannie, thank you. Any further discussion? All in favor, say aye.
Aye.
Those opposed? All right. And then on our equipment replacement, looks like there's some bunker gear.
That there reflects the annual purchase of eight sets of turnout gear we always do inspection. Off of that inspection of turnout gear, then we create a list that needs to be replaced. And we had budgeted for 8 sets, and that's the purchase of those 8 sets. It's an ongoing process. If we don't do it every year, it slowly gets behind, and then you're buying a lot of gear.
All right. Any other questions? All right, is there a motion to approve the expenditures of the equipment replacement fund as presented?
I so move.
Thank you, Gordy. Is there a second?
Second.
Mike, thank you. Any further discussion? All in favor, say aye.
Aye.
Those opposed? All right, thank you. With no unfinished business, let's move into new business. Item 1 is the Kosciuszko County Community REMC Operation Roundup Grant. This is a permission to apply. Chief Bollinger is not here.
I'm going to fill in.
Great, thank you.
So with the Roundup grant, we are looking at going and getting 8 thermal cameras. Right now, we only have 3. So the Department of Fire that we had last week, we only had 3 cameras. So with this Roundup grant, just a little back on the Roundup grant, it says your bill is I don't know, $1.50, and you want to round up to the nearest dollar, that money goes into the grant fund. So with that, they open it up quarterly to start people to apply for grants. So I put in to get us 8 of these thermal imaging cameras. They're about the size of a cell phone. That way we can have everybody on shift able to access this camera and have one. Like I said, right now we're running 3 for 24 hours. There's not much, the difference between these and the ones we're running now is that these are in color. You can see on the printout that's passed around. It's going to help us find victims. It's going to help us find egress to get out of the structure. Not only find hidden fires and any of that stuff, we can go into outdoors, find people missing that's wandered off into the woods just by picking up heat signatures. It goes also for the hazmat. So if the vehicle's leaking something, we can see that at nighttime. We can pick up different thermal functions throughout our scene. I'm asking for $3,000 for their grant, and then we are going to contribute, I believe it's just a little over $1,700. That is for 8 cameras plus 8 keepers that will attach the camera to our person. That way we can pull them up, we can scan the room, and then we can just let it go and it just hangs on the front of us.
Okay. So you said your portion would be about 1,700, but it looks to me like it's about 1,200 because you got a $3,000 grant and the total quote was $42,7192.
And I believe that the numbers might sway. That was a quote for back in January. They told us it might go up quarterly, so kind of shot the higher end of it. And I'm hoping it's lower, but fingers crossed.
Yeah, this quote was dated January 15th. Okay. All right, questions?
So you wear this on your gear?
Yeah, and it's no bigger than a cell phone, and it'll be attached to you. So then I'm able to pull it out and look it down, and I can scan and see everything on the front, and then I just let it go and just retract back in.
Are these cameras, do they have a useful life?
Yes. Depending on the wear and tear, we can get a few years, almost a decade out of them. Depends on how much abuse that they take. The average battery life of these smaller ones are about 4 hours.
So we've got 3 of them now. Have we had others in the past that have worn out?
Yes, and the ones we have now, why we're seeking these is because of the just price range. If we try to get 8 of what we're carrying now on our trucks, they're about $9,000 a piece.
Yeah, and I think from a management standpoint, the ones that we carry on our frontline trucks, they're for the officers. What we're trying to do is get that thermal imaging capability at an affordable cost into the firefighter's hand also. If that firefighter gets separated, then they have a chance to be able to, see through the smoke, see through the heat. And here again, we can't afford $10,000 for everyone to be able to buy that. This is a economical, I don't want to call it a cheaper version, but it's a better way to get that technology into each firefighter's hand. Down the road, it'll all be integrated into our SCBA piece and our helmet. But once that gets here, I mean, we're not there yet in technology. You can get it, but we can't afford it. I mean, it's expensive. So this is a great way to get that technology to each individual firefighter, with the officer still having the one that's like 10 to 12 grand that is the top of the line.
And just perfect example for what happened. He brought up, Brubaker brought up the fire that we had in January. Well, that was a small apartment fire with 0 visibility. Captain Deering and I went in. He went into the right with his camera and was scanning right. I went into the left and started in straight. We found a fire in the bathroom. We passed the lady laying on the floor behind the door. We heard her cough. That's how we turned around and back to town. If I was able to have one, I could have scanned that way and maybe seen her a little bit faster.
Yeah.
I mean, the outcome was still great. She's okay, but maybe we just, the 45 seconds, 50 seconds it took to come back to her, we could have changed that.
So with 8 of them, I assume each firehouse gets a couple?
Yes, it's going to be 2 on all of our first out apparatus.
Okay. All right. I mean, it sounds really cheap to me, $500 to do what that thing does. It's pretty amazing.
And some of the other little functions that it does that some of our bigger ones don't do, they take still shots, so they save. So if we take they'll have a memory in it, so we can go back and look, and it'll actually have pictures on it, so we can see that, like, hey, we ran into this situation here where there was a weird fire layout in this room. And we can take a screenshot of that and save it to trade. But also, one other thing, I get sidetracked. It's not only just for us, it's going to be for the neighboring departments as well when they called us to assist. Also to the high school fire science class. When we go out and train with them, they will be able to use it also.
Okay. Questions?
Do these transmit, do they have Bluetooth or wireless or
They're,
cell service or?
I believe they hook up with a USB cord, so you can plug it into your computer to pull all those images off of.
I guess I was just trying to envision a real-world case where you got your command truck and you got a screen back there, and if you got 2 or 3 guys in a building, whoever's at the command can see on their screen what you guys are seeing.
We would love for you to buy that for us.
Yeah.
I'm just wondering, I think.
It's out there. It's out there.
Yeah. Okay. I think you're identifying another guy for the price of that.
Hold her down.
I was just trying to educate myself.
You forgot how I work. You open the door, I'm walking through.
We can change this if you want to. We
No,
can go
no,
that route.
I'm just trying to learn, that's all. But
they're even-
now I know the
All
answer.
right, any further
Now
questions?
Now I know the answer.
Any further questions?
Somebody besides Mike.
On that, I would make a
Passes
motion
quick.
that we accept.
All right, thanks, Mike. Is there a second?
I'll second.
All right, further discussion? All in favor, say aye.
Aye.
Those opposed? All right, passed unanimously. All right, item 2 would be settlement, opioid settlement grant, matching grant with the state of Indiana. I know Chris has worked hard on this. As he said at council the other night, he's kind of working backwards with this.
We are. We were really pressed for time. We decided we were going to move forward on this. The state announced these settlement funds way late and then said we have to have them in by the end of February. So we got with the mayor, we got with PD leadership, talked about what we wanted to do with this, how we were going to approach it. We did apply for a matching funds through that opioid settlement. We did, because of the timeline, the mayor gave us the go-ahead. We did take it to Board of Works first, which is backwards. We usually come to you fine folks first. They gave us their blessing to go ahead and pursue that, and now we're asking your permission to pursue it. Obviously, if you say no, then we don't have to accept it if we were given the grant, if that is your choice. It is zero matching funds, though, because we're using the matching funds they've already given out in the settlement as the match for that new grant. So we applied for, it was 137,000, I want to say 8, but I'm not positive on that. I know it's
137,816.95.
And I was told that, given the facts we were working off of were an estimate, our actual original settlement dollars are going to be more than that, but it's not going to be a ton more. But we did ask for a match to that amount.
So you're basically eligible for the restricted portion of the settlement and the non-restricted portion of the settlement that was distributed in 2023.
2022 was the number that they told us to use, to match that
From
number.
last year's.
Yes,
right.
sir. Yes.
The first settlement,
Yes, sir.
right,
Yep.
okay.
And there is some discussion about more funds out there coming back around as there are further settlements reached with some of the people
Chris, you want to
involved,
give a quick thumbnail of how you're going to use this money?
We're hoping to continue to just expand that CARES program. We put in there for more money for education, resource development. We've talked about just expanding those services. I've got a little paper that Michaela, because she doesn't have enough to do now, put together a little newsletter that talks about everything she does every month. And she's going to start emailing that to all of you and the stakeholders for the CARES program on what she's doing monthly to help the community. So we want to expand that. We're looking at the vehicle that she's using belonged to Fire Chief Rice. So that's been a day or two ago, so we're gonna have to replace that at some point. I think it's got close to 240,000 miles on it. We're looking through the R-Corp grant to bring another person on, and so there'll be some cost with that as well. But the cost of the employee will be through the R-Corp grant, which we've already talked about previously. So we're pretty excited moving this program forward, kind of shifting focus a little bit. And talking to PD, they really want our R-Corp person to be focused on substance abuse, opiates and substance abuse, because they're just seeing so much that has to do with that, and they want our help. So we're excited, but it's also going to be a little overwhelming as we move into that area. So that's the plan,
Okay,
is to use that money to keep moving in that direction.
so I said the other day, these funds are available, and we need to take advantage of them. It's just right up our alley, and it's been a great program, but we've certainly figured out that you can't divorce mental health issues from drug issues. They're one and the same in many cases. Questions? Excuse me. All right, is there a motion to allow for the applying of the grant?
So moved.
Second.
All right, further discussion? All in favor, say aye.
Aye.
Those opposed? All right. And just for your information, that was passed at the Board of Works
Friday.
Friday.
Yes, sir.
So, all right, item 3, 180 Digital.
So this is what we want to do with the grant we asked you about. We were lucky enough to receive that $7,500 grant from the Kosciuszko County Community Foundation. The whole purpose of that grant was to pay for the website and app, the phone app that we want to put together. They're going to do that for us. Their quote came back at $7,800 with $50 maintenance fee per month. We would like permission to sign that contract and get that started. Again, we are a little bit backwards because we have to get in their queue of things that they're working on. And so we did go ahead and get the Board of Works to approve that as well. And I did forward that on to Andrew for his perusal, since it is a contract, to make sure that we're not doing anything we don't want to do. Our goal here is to take that $7,500 grant and just apply it all towards this project.
All right, questions? Again, this was taken to the Board of Works last Friday, but this is here for your approval regardless.
So it'll be an app that
There'll be a
people can
website.
download on their phone?
Yes, sir. There'll be an app and a QR scannable code so that you could scan that if you're looking for a specific resource. And we want to work with, we had Sarah Graham on board with this from the schools, but she's moved on to greener pastures, or other pastures, I should say. So we want to get the school involved. We're going to have the fellowship mission folks. K-21 will be involved. We have kind of a group of people that are going to come together to map all those resources out. Live Well Kosciuszko has said they'll help us with the mapping of resources as well. So we want to pull it all together. So if you have somebody who's standing in front of you who needs substance abuse assistance, mental health assistance, food, they have no clothing, they need an emergency home repair, they need whatever that need might be. We have, and I've said this before many, many times, we have a lot of those resources in the community. How do you get there? Who do I talk to do that? We want it all in one spot. This has been kind of one of the things we figured out early with CARES, is that I think there were at least 4 lists that I know of, and none of them were good. They were just partial, just piecemealed together. We want it in one spot. We want to put those things in your hands. And we want first responders to have resources that are immediate. You know, if I don't need something till next Monday, that's one thing. I can take care of that myself. But if you have an officer out with somebody who needs to get somebody to an emergency housing situation right now because it's 20 degrees outside, we want them to have a part of that that is just first responder specific.
So, Chief, will part of this money go to promote it to the community so people know it's out there and they'll download it? It's great to have it, but if people don't know it,
We're going to put it out on social media. I know we've already talked to different areas about putting it on their social media as well, and then we'll do some PR with that, I'm sure, to get it out there. The grant specifically was for the development of it, but I know we're going to have to do some public relations to just get it out there.
yeah, you're gonna have to promote it, find a way to promote it.
And I know we've got our business cards through CARES have the QR code already on them. And so in the Sheriff Dukes, the previous sheriff had actually said that they would put it on the back of the sheriff's department's officers' business cards. So you can put it right in somebody's hand. And everybody has a smartphone, it seems like anymore. So they can scan that QR code right there. And it will take them to that app.
Cool. Good job. Thank you.
All right. Any other questions? All right. Is there a motion to approve the contract with 180 Digital?
I so move.
Thanks, Gordy. Is there a second?
I second.
Second, Jeannie. Further questions? All in favor say aye.
Aye.
Those opposed? And we have one more walk-in request.
We did. I was talking to the public education folks this morning in the department. There is a grant out there right now through AFG. It's through FEMA. It's a federal grant, but the focus is on public safety and education. So in talking to the pub ed group this morning, we talked about trying to replace the Save a Life trailer. It is about 30 years old, I think, probably. It has been a great resource for the entire county to use. You take it out, you put it at elementary school, the kids go through it, they learn how to escape the house, how to stay safe, those kind of things. Obviously, in 30 years, technology's changed, so what we would like to do is apply for a grant to replace that trailer. That's specifically what this grant cycle is for. The reason I'm asking you before we're too far into it and why it's a walk-in is because we just found out about it and it's due at the end of the month. So there's no territory board meeting again before it's due. It is a grant that has to have a 5% match. However, we've got that figured out as far as how we would fund that 5%. We have money for that. So just want your permission to pursue that grant opportunity. And as I said, it is due at the end of the
What would
month.
you say the amount of the grant was?
It can be, they're going to give away $100 million, and it's specifically for prevention and safety.
So what's this trailer cost?
We're still figuring it out. That was one of the things I told them I had to know before we could go any further. But again, we met literally this morning, and I said, if we're going to do this, I need exact figures. There are figures out there anywhere from $65,000 to $200,000 for a trailer like we're looking at. But again, we've got figured out what our 5% would look like. I kind of also talked to the County Fire Association a little bit to see if they would be supportive of doing this, because it would be on them to take it to some of the schools to do the education piece. And they're totally on board with that. They felt like it was a great resource for their communities as well. So I don't have an end figure for what we're looking at. I do not, because they're actually meeting with a company tomorrow to spec out what they want to get that quote, to get a hard quote. So I guess all I'm asking for is a little bit of, is it okay to pursue this? Again, because it is due at the end of the month. I don't have great figures. I apologize for that. But just like everything with government, the state government and federal government, it's a timeline thing. We're trying to get in before the deadline. They've said that if you're after the 31st, they will not even look at your application. So we're kind of, again, stuck in a cycle of trying to play catch up with some of this grant opportunity that's out there.
Well, I think it's definitely worthwhile that Save a Life trailer that has been used for at least 30 years. The return on investment on that has been pretty good. So, love to see some of the different technology that's available now, and I'm just confident that a new Save a Life trailer would definitely be used. And this, if there's grants available for it, depending on details, I think it'd be a great thing to support.
And I think, Shirley and Max Kinsey, who's in charge of our pub ed program, they went to Elkhart to look at an inflatable version of a Save a Life deal, because it's more economical. It folds down. Shirley said it folds down into a nice little package for easy transport, but really it doesn't have most of what you need in a Save Life trailer. You want to talk to these kids about how you would climb out a window, how you would escape the smoke, how you get down on the floor because it's full of smoke, those kind of things, depending on the age group. And if I'm missing something, Shirley, please tell me what I'm missing. But
It was pretty basic. It didn't have really any sort of technology. Some of these trailers we're looking at, simulated smoke and simulated stove fires, bedroom fires. It's for fire safety education along with adults, and they have different, they come and train you on how to use the trailer and to get the best use out of it for both kids and adults.
And I guess my hope would be that, if we do this, if we're lucky enough to get that grant, this trailer could then be in service for another 30 years. So, I mean, it is a sizable investment, but if we can get a grant that pays for the vast majority of it, I think it more than pays for itself. Max and the Pub Ed folks do a wonderful job with the schools. This is just another resource. They pull
Would you
this
say it was
out.
a 10% match?
5%.
5%?
Yes, sir.
So your cost can run at anywhere from $3,000 to $10,000 based on that range you gave us.
Yeah.
I mean, that sounds reasonable, and the fact that this is just a permission to apply doesn't bind us. So I think it would certainly behoove us to meet the deadline, and at least get the application in, see what, then we can decide whether or not. We certainly would want more information.
Oh, yes, sir.
But
Absolutely.
I don't think it hurts, based on the context of this, to ask you to allow permission for them to apply.
Certainly, before we would accept anything, we would come to you with real hard numbers, and you would have the choice on what you wanted
Yep.
to do with that. I have no problem with that.
Yep.
I just felt like the last two things I talked about we're doing backwards, and so I'm trying to get I'm trying to get back in front of this stuff. We're just,
These newer technology trailers, is there an ongoing cost to them, other than the supplies, probably for the smoke and that kind of thing, but
I
you
think
don't
just,
have to have an annual inspection or anything like that?
I don't
something like
believe so,
that?
no. But those are things, again, we would
Okay.
find out before we did anything with them.
Right,
And they do have, in defense of Pub Ed, we made that decision this morning. They're having a meeting with somebody tomorrow to get those numbers and to really figure out what the cost of this is going to be.
okay.
So we should have numbers fairly quickly, I would guess.
So if I understand, we're going to consider the question
Just
to
giving
grant,
him permission to apply,
to apply,
period.
but you don't have to give them an answer. That they will come back and tell you before our next meeting, you received it, or you're going to receive it, or you're not going to receive it.
They're not going to dole out the money. I believe this grant doesn't end until July, but the deadline for applications is
And
the
that's
end of
all
this
we're
month.
talking about.
Yes, sir.
Yeah.
All we're
So
talking
we're
about
talking
is
about
applying.
permission to apply.
There's
I
zero
get it.
financial commitment from us other than my time in putting the data together and their time in collecting it.
I can support that. I would make a motion that we allow this permission to go forward to apply for this grant.
Thanks, Mike. Is there a second?
I'll second.
Second, Brandon. Any further discussion? All in favor, say aye.
Aye.
Those opposed? All right, thanks for your work, Chris.
Thank you.
Appreciate
Thanks
it.
very much.
All right, on to travel requests. You have 4 there. Looks like they're all going to the Fire Inspectors Conference.
3 are going to the Fire Inspectors Conference, and then Karen will be going to Valpo for child passenger safety on school buses to keep her cert going.
Does she have the child passenger safety certification? The car seats?
Yes.
Okay,
Yeah.
awesome.
All right. All right. Questions?
So on this total estimate cost, is that 630 for all 3? Or is that each?
That's gonna be Joe's. Joe's down there for 3 days. He's down there today, tomorrow, the 7th, 8th, 9th. Then Max and Joel go down for 1 day.
Okay.
They're just down and back.
Gotcha.
The reason Joe's is so much more expensive is there's lodging included in that.
Gotcha. Okay, make a motion to approve?
Second.
Further discussion? All in favor, say aye.
Aye.
Those opposed? All right.
Sorry, Mike, did you make the motion?
I did.
And then,
Gordy's.
Any other matters come before the board? All right. Comments, questions? Gentlemen, thanks for your time today. Appreciate it.
Will we see Chief Mayo next month?
April 2nd, he begins. And I believe
So we'll
that
see him
April
here.
3rd is he'll have a full day under his belt.
Mayor, I have one more question before we break up. Sorry, Chris. Go ahead.
No, you're good. I was just gonna hand these out there.
Oh, okay. I just had a question for our Lutheran person here. You had mentioned, and I'm just curious, you had mentioned that COVID kind of put a wrinkle in things in January, so I just thought,
Yeah.
can you give us maybe an
No.
update on what's going on locally as far as COVID?
Yeah, so we are seeing some COVID currently, but more so when we talk about numbers. So we kind of, we look at, when we look at data, we look at pre-COVID versus after COVID and what during COVID that kind of number volume kind of looks like. And the number of 911 calls and emergencies we were requested for was the highest that we have seen it in years past previous to COVID. So it's just, it was a very busy month is what that was referring back to. Not necessarily were those COVID-related complaints, just lots of emergencies, lots of medical emergencies happening in January, which is common to see really if you watch the trends of just healthcare when you start getting into cold, flu, respiratory seasons, things like that. But it was a very busy month in January for us. So.
All right, thank you.
Thank you.
All right. Is there a motion to adjourn?
So moved.
All right,
Second.
thank you. I think we got some signatures.